Hello, fellow viewers. Welcome to my channel, Dr. Haring here table. This time again, still in therapeutic medicines. I want to highlight some factors or some of the symptoms that you take note of when we are talking about pre-diabetes. We have diabetes 1, diabetes type 2, and type 1. But pre-diabetes is referring to the symptoms of the early signs of diabetes that you may experience, the first stage of diabetes that you can have, which you will take note of before getting to diabetes 2. Now, being pre-diabetic, here have some symptoms which if you observe on you, you should be very alert and try to go see a doctor or get to the nearest medical facility for checkup. Firstly, on our list, we have dark spots in the armpits, in groin, in areas like on joints or neck. If you see some patches of dark skin there, you should know that there is dense concentration of melanin around that area. That's a symptom of you checking your sugar. Know that diabetes is signaling, it's telling you, I'm coming, I'm coming, I'm coming. You watch out. Next, you have blurred vision. There is an increase in the bulging side of your lens. It leads to some eye impairment. When you start seeing that your vision is changing, you are not seeing objects the way it should be, you are not feeling comfortable, your eyes the way it should be originally, you should have a question mark there. Know that you should check your sugar. That's a signal for you to check your sugar. Frequent urination in the night, always getting up to pee so many times. You used to pee 2, 3 times. Now you are going 3, 4, 5 times to pee in the night. If you know that sugar is telling you, I'm coming, I'm on the way, I'm already around. Not leaving out belly fat, abdominal fat, we think that is wealth, is evidence of money. We are rich, we are having fun, good lifestyle. Big belly, rich man, big man. No, that's sugar symptoms. Abdominal fat, visceral fat is not too healthy. When you start having that, means that there's an increase in your cortisol, stress hormone, and also insulin resistance is existing. Insulin resistance means that your body and sugar, they are not working together. That means the insulin is no more responding. It's coming more than needed, but it's not doing any job for your body to bring down sugar. It's a chemical hormone that is produced at the level of the pancreas. So it's also produced alongside glucagon. So we have to make sure if you are having insulin resistance, know that you are very close to diabetes 2 particularly. Now we have tingling, something like needle sensation, tingling, we could say locally, in your palms, on your feet, the tips of your toe. When you experience those things occasionally, cramps, numbness, you should check on your sugar, especially at night when you are on your bed. You watch out for sugar increase. You know that diabetes is very close. Then we have the glucometer, a machine that we use to check blood sugar. We can use that to attest or get to the nearest medical facility or you see a medical doctor for checkup. We are not concluding that at any time your blood sugar level is high, it means that you have diabetes, but the doctor is in best position, your medical doctor is in best position to determine whether you have diabetes or not, especially when he will use a test. He will recommend a test we call HbA1c that would let him or her to understand if you are diabetic or not, or the level of diabetes that you have found yourself. And also, if you observe that when you have a wound, you have an injury, it takes some time for it to heal. That's another symptom of somebody who is becoming diabetic. It means that you are at the early stage of diabetes, we call it pre-diabetes. You have to watch out and ensure, as a diabetic or pre-diabetic patient, always ensure that you don't get yourself a wound for any reason. You protect yourself. If you're a farmer, you have the type of person who is into going to the farm or do some kind of activities that expose you to mechanical injury, put on hardwares like boots, like jean trousers, hardwares to protect yourself from having injury. Now we also talk about those who have cravings for sweets, like sweet drinks, sweet fruits, sweets, to lick sweets, those kind of stuff. If you always like cravings, means you have the interest of consuming much of those stuff, you should watch out. You know that sugar can cause you to do that. That's one of the symptoms of diabetes, when you have high cravings for sweet things. Now we also talk about skin tax. like body wax, like wax, for instance, those tiny things that grow on the skin. In childhood, they used to call it locally in Cameroon that a goosey growing on the skin is tiny. You find it on the body. When you see it, sometimes it could be caused by human papilloma virus. But it will express itself. The virus might be in you, but when sugar level rises, you will see the expression of the presence of this HPV, human papilloma virus, in your body. That's another symptom of diabetes, though it can still come like that when you have cancer or when you just have the human papilloma virus that have stayed for a while or have exceeded its particular duration in your body. Finally, we'll talk about anxiety. You always have some kind of anxiousness in, unnecessarily 1 to 2 hours, especially after meals. You feel like doing a new thing, you feel like very anxious. That's another symptom of diabetes. And the last part of which I will talk on is fatigue, unnecessary tiredness. When you get tired unnecessarily, you check your blood sugar levels. Now, normal average blood sugar level should range between 70 milligrams per deciliter of blood to 110 mils. But it varies with the kind of machine you are using, the kind of glucometer they are using. So the doctor is in position, or the technician, depending on which he's using and the kind of reagents they are using. Thanks for watching my video, but we should understand before I will leave you, there are some certain things that you have to do. You avoid eating rich carbs late. Eating carbs late, that's the way of preventing diabetes. Don't eat white foods late after 4, 5, 6, especially for adults. And also avoid eating in between meals. You should learn to practice what we call intermittent fasting. Means that you should have fixed time that you eat. You eat more heavier foods in the morning rather than in the evening. You don't eat heavy foods later in the day. You eat those heavy meals in the morning. Before evening, the carbohydrates or starch-rich foods will be broken down and used up. Note that your body will always store excess sugar. So when you eat white food that contains sugar late, your body is going to store it for future. And when it does that over a long period of time, it can lead to the condition known as diabetes. And we should also know that diabetes could be hereditary. You can have it as a result of your father having and you have inherited, or you are living a sedentary lifestyle. You don't sit here and tell a child to come from the football field and get a remote control and give you beside, or a cup of water to give you. It means you are sedentary. And if you put on long hours sitting in the office or in a business place during the day, you don't do that later in the day, in the evening, to still come back home and sit down for too long. That's also a form of sedentary lifestyle. But we advise that you do sports regularly, especially for those who are 50 upwards, should do 3 times at least walk in a week. Excessive sport does not bring down sugar, does not stop diabetes. What we need, the backbone or major part of diabetes control, is dietary plan. You should learn to go in for semi-ketogenic diet, or keto diet is good, or a vegetarian diet too can be of help. But we should know that all the classes of food are necessary, but we should take them adequately. Thanks for watching my video. Don't forget to press the thumb up and also share with your friends and relatives. And there are some veggies that will help you to combat sugar, to regulate your blood sugar, like you going in for what? Cabbage, go in for bitter leaf. Those are all bitter herbs. Those are all very good vegetables that help to make sugar not to be elevated. The avocado, the round pear, is also a good food to help to stabilize your blood sugar levels. And we should take note that we should substitute cube of sugar. Always learn to substitute your cube of sugar with honey. Excluded in this therapy are those who are pregnant, or those who want to get pregnant, or children between 0 to 5 years. But we should know that honey is very good, not just as a sweetener in your foods. It's also very medicinal because it's the only substance in the world that have similarities to blood compared to any other substance. And it also have a good boost on the intelligence or intellectual capacity in terms of cognitive reasoning for those who consume it. Studies have shown that those who take honey in place of sugar in warm water as tea or breakfast, or alongside their meals, for those who used to take tea, which I don't so much encourage, but those who take honey in warm water regularly, they have a more stronger cognitive reasoning. Thanks for watching, and don't forget to give a thumb up and press the share button. Bye bye.